Hey folks, welcome back to Ndaba Africa. This is Chris. Well, on the 1st of February 2021, President Cyril Ramaphosa chose to speak to the nation once again. He addressed South Africans regarding the COVID-19 crisis, the Wuhan coronavirus, COVID-19, and what's going on in South Africa. I have to say that watching the beginning of his speech, I was a bit concerned about his condition. He did not appear to be at all well. He sounded ill, congested, a little dazed and confused. All in all, it looked like he was sick, that perhaps he's come down with influenza, he's got the flu, got some sort of bug, or maybe even the Rona itself. Who knows? But best of wishes to Cyril Ramaphosa, and hope that you are not actually suffering from this. Well, he shared a number of things with us, including the information that his top scientists have told him. Now, it's interesting because he mentioned once again that South Africa believes that it will achieve herd immunity with 67% of its population vaccinated. Now, Ramaphosa is a realist when it comes to the point that he mentioned that that vaccination includes not just South African citizens, but even illegal aliens currently in South Africa. Makes sense. They're also Homo sapiens. They can carry the disease. The fact that they are there illegally doesn't prevent them from spreading it. So 67% of those occupying the terrain of South Africa would achieve herd immunity. That's a good number. For epidemiologists, that's not an unusual figure. Mark that in contrast to Dr. Fauci, Dr. Fraud, who now works for Unity Joe here in the United States, who once also claimed for months that herd immunity would be 60% of the population with immunity, whether it's through vaccinations or having previously suffered from the virus and developed antibodies to it. So 60% would be herd immunity. But as time progressed and as the need to get rid of Orange Man Bad, Donald Trump, from office became increasingly important, this deep state operative, Dr. Fauci, kept upping the numbers. So either he's a political fraud or he is very stupid and not very bright. How does someone who spent 37 years in charge of a directorate in the National Institutes for Health change his concept of herd immunity in a period of just 4 months from 60% to 70% to 80% to 85% to, I'm not going to say it, but really I think it's 90%. How in the world does that happen? A 50%, nearly 50% increase. Wow. 90% might as well be the entire population. Anyway, so back to Cyril Ramaphosa. His scientists have told him 67%. Now, he took the occasion to also dispel some rumors that are floating out there about the vaccination program for South Africa. Number one, he pointed out that there will be no compulsory vaccinations. No South African will be vaccinated against their desires or will. You heard him, 1st of February. Let's make sure that's documented and repeated so that when officials attempt to force vaccinations on people, we all know that the president himself said no such thing. Also, there will be no travel restrictions for those who choose not to get vaccinated. Document that as well. Now, he told us that daily admissions to hospitals across South Africa have declined from 2,300 at their peak just a few weeks ago in mid-December to only 295 on a 7-day rolling average just before his speech on the 1st of February. Also told us that new cases of COVID-19 turning up in the country have dropped from 10,000 per day in mid-December to just 5,500 per day now. While this is the basis for removing many of the restrictions taking place under level 3 lockdown, which is what South Africa is at, although it's hard to know because they take restrictions from different levels and apply them in this level. It's very confusing. But he said the country will remain under level 3 lockdown. But it's interesting to note that 5,500 cases, so that's why they're going to lift the restrictions. Last year, when there were less than 100 or 200 or 300 cases per day, they locked people down for 21 days with the excuse they had to get the hospitals and the schools ready. Yet they failed to prepare either. The restrictions on faith-based gatherings have been lifted. People can go back to religious services. The curfew has been reduced now to just 11 p.m. until 4 a.m. Gatherings, however, are still limited. Maximum indoor capacity is 50 people or less. Outdoors, 100. 50% of capacity for a venue indoors is the max. Now, outdoor venues, 100. That makes no distinction between people gathering for a braai on a beach or those trying to attend a soccer or rugby match in a stadium that seats 40,000. Why can only 100 people go to a stadium that seats 40,000? That's outrageous. Easily you can maintain proper social distance, not 2 meters, the fraudulent distance that the officials tell us, but actually a proper distance of about 6 or 7 meters to keep you away from sneezes and coughs. That can be achieved, and thousands can still attend venues. Ridiculous. Political gatherings, interestingly enough, political gatherings are still banned. You cannot have a political gathering in South Africa. Alcohol restrictions, which is the news that many have been waiting on, have been eased. And with package stores now permitted to sell alcohol Monday through Thursday once again from 10 a.m. to 6 p.m. Watch the lines today. They probably were quite long. Duty-free wineries and microbreweries are permitted to sell alcohol, but only for off-site consumption. So what's the point of a microbrewery or a winery if you can't sit there and enjoy your drink? Mask wearing, the unconstitutional dictate from the National Coronavirus Command Council that is not legal, remains compulsory. In public spaces, all South Africans must wear a mask at all times or risk imprisonment. Wow, and fines. Now, he did a very bizarre thing. Of course, the ANC, this isn't the bizarre part. They, of course, congratulate themselves, pat themselves on the back for what a great job the ANC has done in fighting coronavirus when it's completely fiction and the opposite. They've done the absolute worst job on the planet, and this is probably the least successful example of how to deal with coronavirus is South Africa. Not only have they not enforced it in the townships and rural areas when they should have, thus allowing it to spread, they've criminalized the behavior of over 250,000 South Africans, law-abiding South Africans. They've destroyed the economy, crushed millions of jobs, pushed tens of thousands of people out of business. The restaurant industry is about to collapse entirely within days. The tourism industry is virtually dead, may never recover. In the midst of that, they've racialized society by coming up with equity plans to finance competing businesses so that they can be created in the midst of a pandemic while other businesses fail that they refuse to give tourism relief to. It's unbelievable. But if you think that was the height of lunacy from the African National Congress, during the midst of this discussion to the nation, Cyril Ramaphosa felt it was important to praise Cuba. Cuba, that's right, ladies and gentlemen. Cuba apparently sent doctors, as we know, last year to South Africa. They've never been seen. Nobody knows where they're out. There's no reports of them in the press, no television coverage, anything they've done. By all accounts, they sat in a hotel somewhere, and they were paid 451 million rand for this. Why? South Africa has doctors and nurses not being utilized, and hospitals are not full despite the lies told by the government, and they're hiring Cubans. And now they have nominated, he has said the parliament will nominate the Cuban Medical Brigade for the Nobel Prize for their actions in helping stop the COVID crisis in Africa. What a joke that is. Yet more proof that the Nobel Committee is feckless, useless, and an absolute sham. He also mentioned worries about the so-called South African variant of COVID-19, saying infections are 20 times higher indoors and outdoors for COVID in general. Now, of note, in this discussion, Cyril Ramaphosa failed to do a few things. Now, if he said it, we missed it. Perhaps people were focused on being able to get a little bit of drink from the package shop. But three things that didn't jump out that are very strange. Number one, there was no mention of border crossings and travel restrictions. Are South Africa's borders still closed? They should be, because they were announced at the beginning of the month that they'll be closed into February. So one would presume that the borders, there's no change. However, he did not address it, which was odd. He also failed to mention school reopening. Yes, it's been announced that schools will reopen in February, but it was also announced they were going to open in January 27th. Didn't happen. Did not happen. They were delayed. So why didn't he not mention school reopenings? That's two of the most important issues for all South Africans is border crossings, travel restrictions, same category, and school reopening. And finally, if I missed this, I'll apologize, but I don't think I'm the only one. A lot of people said the same thing. When exactly does this stuff take effect? Normally, he makes it very clear when things take effect, but as I said, it seems as if Ramaphosa was off his game and under the weather. He did not mention when all these changes take effect, so he left us guessing that it's immediately. So were, in fact, people out today buying booze all over South Africa? If that's the case, then we can assume that it was, in fact, effective today, the 2nd of February. I guess you'll have to go and try to buy some booze to find out if, in fact, this is in effect now. Whatever the case, folks, Cyril Ramaphosa has updated the nation. Curfew is eased. Alcohol restrictions are eased. Admissions to hospitals are down significantly. According to Ramaphosa, the number of people coming up positive each day for COVID has declined by 50% over the past few weeks. And apparently that's enough to ease the restrictions and let people go back to the same patterns and go through this all again in 6 weeks. These people have absolutely no idea what they're doing, folks. If you think they do, then you're really confused. Anyway, if you're not a subscriber to Chris White Africa, take a moment, become a subscriber. Boom, right down there. Update the bell icon, or push the bell icon so you get notified of updates. And finally, smash the like button. Likes supposedly drive viewership here on YouTube, and we're trying to get more people the message. Thanks a lot. Appreciate your custom, your courtesy, and your time. Take care, folks.